Yes, people change as they age, and many things that we see are these mild, gradual changes associated with normal aging. We get a little slower, our strength declines, and we might need more aids to get things done. But what happens when a loved one takes a sudden turn for the worse? They seemed fine last week, but this week they're suddenly confused, they have severe memory problems, or they seem paranoid or anxious or agitated. Is this normal aging? And how do we find out? If you're seeing anything like this in your loved one, this video is for you. We'll walk through the steps I would take if I were concerned about an acute change in a loved one, or if you were here in my office consulting with me about yours. At the end, I'll give a pro tip on ways to prepare for such a problem in the future. First, let's clarify. Sudden changes that aren't the way your loved one generally is are not usually considered to be normal aging. We want to take action quickly and rule out any medical causes that might be contributing to this acute or sudden change. Medically, there are several things that might be happening. They could be things like a stroke or a mini stroke, a TIA, an acute infection like a urinary tract infection, a delirium from some type of illness, medication side effects or adverse reactions, dehydration, metabolic disorders, or psychiatric problems like sudden anxiety or severe depression. Now, what's the definition of taking action quickly? If this is an emergency, this means an immediate trip to the emergency department. This is often for changes that are concerning of stroke or other severe significant problems. This might be seen through sudden numbness or weakness in arms or legs or one side of the body in particular. It may be seen in slurred or garbled speech or difficulty comprehending what other people are saying. It could be sudden problems in vision in one or both eyes. It could be problems with dizziness, loss of balance or coordination, or even sudden or severe headaches with no known cause. Visits to the emergency department can be challenging. Loud noises, too many people, chaotic environments, temperatures that might be too hot or too cold, a lack of easy access to water or snacks. All of these can make the emergency department challenging for anybody, but it can be especially difficult for older people. Try to be as prepared as possible. You might want to bring layers of clothing or a small blanket, and it could be helpful to pack water and easily consume snacks. If you want to, you could prepare a kind of a go bag beforehand for these kind of emergencies. Kind of like the bag that I packed when I was pregnant and knew I'd have to suddenly go to the hospital, where it has all the stuff you think you're going to need. It could really save you time and stress in the moment. Once you do see the provider, be prepared to tell them what has changed over time and how this is not normal for your loved one. Bring a list of current medications and also let them know if you have any concerns that maybe the medications haven't been taken correctly. Advocate for finding the root of the problem, not just something that might be easily treated and your loved one is sent home. For example, they might say, well, your loved one is dehydrated, and they could provide oral or IV fluids. That might be helpful in the moment, but dehydration could be a symptom of a larger problem. If you've determined that this isn't an emergency, but it's still an acute change without an apparent cause, then a trip to the emergency department might not be the best idea. Instead, check with your loved one's primary care doctor to see how quickly they can be seen, stressing that this is a relatively urgent matter. Ideally, they might be seen within a few days or a week. If at all possible, go with your loved one to their primary care doctor's visit. This will help to ensure that everything is communicated fully. Bring a short list of your concerns, ideally typed out and in bullet points, to be able to express those concerns to their doctor and to be able to hand it to them for later review. Bring a list of your loved one's current medications and be sure to bring up any concerns you might have about whether or not they're taking them correctly. Be informed in terms of what type of tests, like blood work or urinalysis, the doctor may consider to rule out reversible causes of problems. If you're not familiar with these ideas, I have a video that walks you through them. If your loved one's provider isn't bringing up a conversation about running those tests, then you can advocate for the use of them. Overall, please do advocate for your loved one, stressing how this is an acute change. It's very different than your loved one was before, and there's no apparent cause. It's okay to resist interpretations that this might just be normal aging. Ask for next steps to rule out possible causes. And also, if these tests were ordered in terms of blood work and urinalysis and so on, ask what the next steps might be if all of those tests come back negative and aren't explaining the sudden change. If a thorough workup with your primary care doctor has been done, including whatever blood work, urinalysis, brain imaging, or any other tests that they think might be appropriate, but it still hasn't explained the cause, don't despair. Continue to observe your loved one, document what you see, and request continued investigation. This could be in the form of referrals to neurology for neurological workup and brain imaging, to neuropsychology for neuropsychological evaluation and understanding of brain strengths and weaknesses and patterns of dysfunction. It could be a referral to psychiatry or psychology if the main concern is depression or anxiety or some other emotional disturbance. If you're not sure what types of doctors that might be available to your loved one, I have a video talking about several of them and what they do. If you'd like more information on neuropsychological evaluation, what that is, what it's like, and how it can help, I have a video for that as well. All right, time for the pro tip. So if you are going to the emergency department at any point with your loved one, this can be a pretty stressful experience. The pro tip is to investigate beforehand whether or not your community has geriatric-friendly emergency care. Some hospitals are changing their emergency room departments to make them more friendly and accessible for older people. The changes that they make might be their providers have more training in geriatric care. The environment might be different and more geriatric friendly. They might be paying more attention to medications and medication interactions. There may be more attention to your personal goals and goals for care overall. There's often more attention to people as they come in and go out of the emergency department to ensure that things don't go wrong. And there may be more support for caregivers. In fact, there is an innovative collaboration designed just to improve care in emergency rooms for older people. This is referred to as the Geriatrics Emergency Department Collaborative. The American Geriatric Society and several other national organizations have partnered with various individual and hospital systems to improve care for older adults in emergency departments. They've created a series of videos specifically on brain health in the emergency department. This provides a model not only for the workers who are in emergency room departments. This provides a role model for caregivers in what to think about and how to be educated and how to advocate for the best possible care for your loved one in the emergency department. I'll put the link to those videos in the description below. So remember, acute changes in your loved one's functioning are not generally associated with normal aging. Ideally, we can figure out the cause and we can intervene to reverse those problems and come back to a normal baseline. But even if we can't, it's still important to get our best guess as to what caused the problem, because this allows us to be more empowered and better informed on sustaining health and wellness into the future. I hope that these ideas are useful to you and your loved ones. And if so, feel free to share them with other people that you think might benefit.